Welcome to today's presentation, Enhancing Language Access, Assessing Bilingual Health Center Staff Competency. Today, I'll be your speaker, and my name is Megan Martinez, and I'm the Health Initiatives Program Coordinator here at the National Center for Farmworker Health. So for those of you who may not be familiar with NCFH, we are a private, nonprofit organization located outside of Austin in Buda, Texas. And our mission is to improve the health of farm worker families. And we do that by providing different programs, trainings, and technical assistance and resources. We celebrated our 45th year anniversary in 2020, and we are very proud of being able to serve the 175 migrant and community health centers in our network who provide primary care services to agricultural worker families. I just wanted to tell you a little bit about our Ag Worker Access campaign. This Ag Worker Access campaign was launched in 2015. It was a joint effort by the National Center for Farmworker Health and the National Association of Community Health Centers. We, along with health center staff and other ag worker advocates, knew that a lot more could be done to increase access to quality healthcare for America's agricultural workers and their families. The results of this was the Ag Worker Access campaign. We have seen steady increases in the number of ag workers served in health centers since the campaign's launch in 2015. In 2021, we surpassed our halfway milestone of 1 million ag workers served. Unfortunately, in the 2022 UDS data, we did see a decline. But we are confident in the hard work and determination of health centers across the country that we continue growing from here. But we need that with your help. So today I ask if you all would like to join. Please use the link. I believe it will be dropped into the chat. You can also go onto our website, ncfh.org/agworkeraccess, and you can join the campaign. So to get us started on today's presentation, I'll first go over our learning objectives for today. We will be recognizing the importance of language access services and learn how to effectively evaluate the language competency of bilingual staff. We will also identify and distinguish different proficiency levels of language access services needed while considering the specific language needs of patient populations, including speaking, listening, writing, reading skills, and of course, medical terminology interpretation abilities. And lastly, we will explore additional resources and tools, including NCFH's Assessing Bilingual Staff Competency Tool for workforce development, as well as competency assessments. We'll introduce today's topic by first covering why language access programs matter and why they're so important. So kind of to kickstart us off, we're going to begin with a little poll question. We just want to gather some information from you all just to see where your health center currently is at. So the question would be, do you know if your health center currently has assessments in place to assess staff language competency and proficiency? So as soon as you see the poll pull up, you can either mark, yes, we do, no, we do not. We are working on implementation of how to assess staff, or if you're unsure, feel free to click on that option. And we'll just take a minute or so here while we get those responses in. It looks like we have a mix. 55%, yes, we do. 18%, no, we do not. 9%, we're working on implementation, and a few 18% unsure. Perfect. So we just received, yeah, it's still about the same, a good mix. So thank you all for sharing. We kind of just wanted to gauge where everybody is at as we continue on this presentation today. So we'll begin with the importance of assessing health center staff language competency. So one of the main reasons why this is so important is because health centers must have interpretation and translation services in order to follow the rules of Section 1557 of the Affordable Care Act. So this law clearly says that health centers must take steps to serve people with limited English proficiency, like using a qualified interpreter. Bilingual staff are also such valuable assets when serving patients with language access needs. But health centers really do need to properly assess the language competency of the staff as well as their qualifications. So on this screen, you'll see some of the benefits of language access programs and assessing bilingual staff competency at your health center or organization. Some of the things highlighted here include increased equity for patient care, increased accuracy, confidentiality, increased accessibility to services, as well as patient safety, increased feelings of respect from patients. Um, Diversity, professionalism, again, accuracy. So these are just some of the things that we wanted to point out. But just to hear from you all in the chat, if you can please just type in your thoughts on what are some of these benefits that maybe stick out to you the most, or if you don't see one that's listed here that maybe comes to your mind, if you can please plug it into the chat. We just want to hear from you. What do you think are some of the benefits of language access programs um, at your health center organization? Mm. Or anything that sticks out to you from what you see on the screen? Power of or patient on decisions of their own health. Yes, taking control, empowering them to take control. I love that. Building trust and building trusting relationships. Yes. Connecting to the people you serve. Yeah, that's a really important part of patient care. You want to feel that connection, right? Um, None of the services are available to people proficient in another language without it. Yes. I love that. Thank you all for sharing. Thank you so much. Those are all great responses. So now comes what are some of the challenges of language barriers? Because we all know that there's so many challenges that we face, right? First, there's challenges that patients face. So the impacts of language barriers on the patients include medical errors that could have been prevented, uh, low treatment adherence, low health seeking behavior, um, possible additional treatment cost that may have been unnecessary, sometimes increased length of hospital stays, um, weak therapeutic relations, social desirability, maybe feeling less confident in their overall healthcare and dissatisfaction with the healthcare that they're receiving, right? So maybe they'll choose to stop going to their medical appointments or to stop keeping up to date with their medications because they just don't feel satisfied with the overall healthcare. And then there's also a lot of challenges that the medical staff and health center staff face, right? And when it comes to having difficulty understanding patients who do not speak their own language, it can potentially, like I mentioned, lead to misdiagnosis, lead to the prescribing unnecessary or the wrong medications. And and again, patients can also have problems maybe scheduling their appointments if there's not someone who a staff member who is scheduling appointments who is meeting their language communication. There can also be problems with that. And I just want to see something in the chat. Yes, somebody mentioned decreased quality of care, poor health outcomes. Yes, thank you. and continued on with discussion. So those are just some of the challenges that I posed, but we want to hear from you as well. What types of challenges do you see your patients having due to language barriers? Or what are some of the most common challenges you face as a health center staff due to the language barriers? Because you all are the ones that are at the health center, right? Seeing these patients on a day-to-day basis. So can you maybe type in the chat, what are some of the challenges that you see? And maybe what are some of the things that you have done to address those barriers, to address those challenges? Um, we would like to share with everyone because sometimes it's good to learn from somebody else. Maybe somebody else is experiencing the same challenge as you, the same barrier, but they haven't found a way, a solution to address it. So we want to hear from each other. Yes, somebody mentioned low literacy levels. The interpretation needs to be exact so that it is a successful meeting. Yes, and we'll go over that a little bit later on in our presentation. So thank you for mentioning that. Distrust, right? It can lead to a lot of distrust, misunderstandings, right? Um, Even if speak Spanish, they don't understand the accent. Yes, correct. And there's a lot of different cultural variances to Spanish, right? And we're gonna go over that later on also in the presentation a little bit. Anyone else like to plug anything into the chat before we move on? Advocating for patients who understand some English but still need interpreters. Yes. Right? You don't wanna take it for granted, "Oh, they know a little bit of English, we'll be okay." No, you wanna make sure that they completely have full, confidence in what they're listening to, what they're hearing, and what they're taking from the physician or health center staff. So that's a good one. Thank you so much. Making sure children are not interpreting, since that is such a burden, and providing trained professional interpretation instead. Yes, that's very important. And not just children, right? Because sometimes if you have a family member interpret, they may interpret what they want to hear because maybe they don't necessarily want to interpret what they're actually hearing. So that's very important as well. Biculturals, yes. Um, would teach back work for this type of challenge? I think that teach back is always important to incorporate, but it's still necessary to have that professional language component to it um, to ensure accuracy. Less likely to have routine health visits. Yes. Great. These are all great. Thank you all so much for sharing. So, like we said, and like some of y'all mentioned, there's lots of benefits to addressing these language barriers, right? Um, some of these can be, again, like some of y'all mentioned, improved patient communication, improved patient satisfaction, improved overall health outcomes, and improved patient retention. Like patients will actually want to come back to their medical appointments, right? Because there will be that level of trust, that level of understanding, and that relationship building. So, bilingual healthcare professionals and interpreters really help to improve just the overall healthcare outcomes by really facilitating communication and bridging cultural gaps between both patients and providers. So next here, this is a pretty lengthy case study that I found, but it's a really good case study. And Maria's gonna go ahead and drop the link in the chat for you all, and that way you can save that link or open it up in another tab and to go back and reference at a later time. It's a really good case study because it really speaks on the impact that language has on patient care, on satisfaction, and comfort when really sharing sensitive information during the medical session or during the medical care. Um, so I would recommend that you really go back again and the link has been dropped in the chat and read more into that. And it's by the National Library of Medicine. So a lot of really good information and research that was done through that case study. But for today, just for time purposes, we do have a case study that we want to share with you, and it is about 9 minutes long. But I think that this is a really good case study because It really shows you from beginning to end the importance of just working with an interpreter. So let me go ahead and play that for you. And let me know if you can't hear the sound or anything so that I can fix that.
Elena Sanchez, a Spanish-speaking Latina woman, brings her daughter Rosa to see her pediatrician for her annual physical. Because the clinic receives federal funds, it provides competent language access services at no cost to its limited English proficient patients. A trained interpreter is present during the visit to serve as a conduit between Elena, her daughter, and the clinic staff. The Sanchez family is not alone in its struggles with weight. To help address their patients' needs, the clinic has started a wellness program for families. The program focuses on prevention messages that are culturally and linguistically appropriate. Topics addressed during this video include importance of culturally and linguistically relevant prevention messages, the role of the interpreter in a clinic and consultation visit, the importance of community resources and family support in program adoption and adherence.
Good afternoon. How are you doing?
Buenas tardes, ¿cómo está?
Bien, gracias.
Good, thank you.
Today we are here for Rosa's annual physical for school. Is that correct?
Hoy en día estamos aquí para el examen físico anual de Rosa para la escuela, ¿es correcto?
Sí.
Yes.
And right now I'm concerned that Rosa's age and body mass index are telling us that she's at greater risk of being an overweight adult.
Ahora estoy preocupada que la edad y el índice de masa corporal de Rosa nos indiquen que ella tiene más posibilidades de ser un adulto con sobrepeso.
We'll continue to monitor her progress.
Pero vamos a seguir vigilando su progreso.
Bien, gracias.
Good, thank you.
It's good that you feed her well and that she's staying active, but I'm still concerned about her weight.
Es bueno que lo alimente bien y que se esté activo, pero sigo preocupado por su peso.
She's overweight for her age, which is putting her at risk for diabetes and heart disease.
Ella pesa de más para su edad, lo cual lo pone en riesgo de tener diabetes y problemas de corazón.
Also, this extra weight throughout her childhood and life would mean a greater risk for other chronic conditions.
Además, este peso extra a lo largo de su infancia y su vida lo pone en mayor riesgo de tener otras afecciones crónicas.
But it's important to know that if she starts making healthy choices now, the risk for these will decrease once again.
Pero es importante saber que si empieza a escoger opciones saludables ahora, el riesgo de tener esto volverá a disminuir.
Getting Rosa to a healthy weight now is very important in preventing health problems later in life.
Lograr que Rosa tenga un peso saludable ahora es muy importante en prevenir problemas de salud más adelante de la vida.
There's an education program at this clinic that you might be interested in, and Mary can give you more information about it.
Tenemos un programa de educación aquí en la clínica que le puede interesar. Mary te dará más información sobre esto.
We'll see you both soon.
Los veré muy pronto.
Rosa, have fun playing.
Rosa, diviértete jugando.
It's good to see you again.
Es bueno verla de nuevo.
Dr. Gilbert wanted me to further explain the wellness program we offer right here at the clinic.
El doctor Gilbert quiere que le explique con más detalle el programa de nutrición que ofrecemos aquí en la clínica.
The clinic has developed a nutrition and physical fitness program for kids like Rosa and their parents.
La clínica ha desarrollado un programa de nutrición para chicos como Rosa y sus padres.
The class runs for 6 weeks, 2 days per week.
La clase tenga una duración de 6 semanas, 2 días a la semana.
The really great news is that Rosa will know many of the kids in her class because they attend the same school that she does.
La buena noticia realmente es que Rosa ya va a conocer a la mayoría de los chicos en la clase porque ya asisten a la misma escuela.
And you'll also get to meet other parents who also want to help to make their families healthier.
Y usted encontrará con otros padres que también quieren ayudar a sus familias a ser más sanas.
Do you have any questions?
¿Tienes alguna pregunta?
No, Rosa nunca ha participado en este tipo de clase y yo nunca he escuchado a nadie hablar de este tipo de clase. Entonces es difícil para mí hacer preguntas en este momento.
No, Rosa has never been in such a class, and I've never heard of such a class before, so that's why it's hard for me to ask questions right now.
Y tampoco estoy segura de lo que están sugiriendo. Yo trabajo con muy pocos recursos y doy lo que pueda a Rosa.
And I also don't know what you're suggesting. I work with very little resources, and I give what I can to Rosa.
I recognize your concerns, but I believe that we can work together to keep Rosa healthy.
Reconozco tus preocupaciones, pero creo que podemos trabajar juntos a mantener saludable a Rosa.
She'll learn more about how to stay healthy as she gets older.
Ella aprenderá más acerca de cómo mantenerse saludable a medida que crece.
Pero ella ya es una chica saludable. Yo le preparo tortillas y frijoles y otros alimentos de mi cultura. Y ella juega fuera de la escuela con otros niños.
But she already is a healthy child. She eats beans and tortillas and other foods from my culture. And she always plays outside with other kids after school.
That's great. We do not want to change the foods that you're eating entirely, but we do want to help you to make these meals a little healthier.
Eso es genial. No queremos cambiar por completo los alimentos que están comiendo, pero sí queremos ayudarle a preparar estas comidas en forma más sana.
We will also work with both of you to help her to understand and choose healthier eating options.
Trabajaremos con los dos para ayudarle a elegir y entender y elegir opciones más sanos.
In the classes, Rosa will have the opportunity to learn about healthy eating and exercise.
En la clase, Rosa aprenderá sobre la nutrición y el ejercicio.
She will also play interactive games that teach her about what foods are better for her body than others.
Jugará juegos interactivos que le enseñará qué alimentos son mejores que otros.
We will also teach her about fun ways to stay active throughout the day, even at home.
Y también aprenderá maneras divertidas de mantenerse activos durante el día, incluso en casa.
Ok, bueno, yo creo que suena como un buen plan, pero me preocupa que ella va a pensar que algo anda mal con ella. En mi cultura, ser capaz de sentarse derecho, tener piel y pelo saludables son más importantes de el peso adicional de un bebé.
Okay, I think it sounds like a good plan. I'm worried that she's going to think something is wrong with her. In my culture, to be able to sit up straight and to have healthy skin and hair is more important than a little extra baby weight.
I understand you have doubts about this program.
Reconozco que tiene dudas sobre este programa,
We have Rosa and your best interests at heart.
pero tenemos a Rosa y sus mejores intereses en el corazón.
You've been coming to this clinic since Rosa was 11 months old. We would not suggest this program unless we thought it was appropriate.
Usted ha estado viniendo a esta clínica desde que Rosa tenía 11 meses de edad.
Sí, ya veo. Al principio tenía miedo cuando me estaban explicando el programa, tenía miedo que estaban tratando de cambiar nuestro estilo de vida. Pero ahora ya veo que el programa ayudará a Rosa y yo a aprender sobre la vida sana.
Yeah, no, I see. At first, when I heard about the program, I thought you were trying to change my lifestyle. But now I realize that this will help me and Rosa learn more about healthy living.
I'm glad that you took the time to listen. We at the clinic are here to help.
Estoy contenta que haya tomado el tiempo de escucharme. Nosotros aquí en la clínica estamos aquí para ayudarla.
Would you like to get started and sign up for the wellness program?
¿Quieres empezar ya y registrarse por el programa de bienestar?
Sí, me gustaría darle una oportunidad.
Yeah, I'll give it a try.
Great. I'll get the registration form.
Bueno, voy a buscar la forma de inscripción.
Please consider these self-guided questions. What was important for Elena to learn about the program? Elena Sanchez, a Spanish-speaking Latina woman, brings...
Okay. So how impactful? What did you all think? What did you see there? I thought that was such an impactful way of showing the importance of language interpretation because as you can see, they were able to, while it did take longer, and I do recognize that we don't, you all are so very busy at the health centers, all health center staff, all physicians, everyone's very busy. There's so many patients to see. it's still so necessary and so important to be able to provide this language access and interpretation because it at the end of the day, you get, again, increased patient engagement. You like this person, this patient, Elena and her daughter Rosa, would never have known about the program without the language interpreter, right? And they would have just, if someone had just told them just kind of very vaguely what the program was about, maybe they wouldn't have attended because, like she initially was saying, she was so hesitant because she thought that they were kind of trying to change, their ways of being, their culture, things like that. She really didn't understand about the program. So the need for that interpretation was so necessary, as you saw there. But just any other thoughts about this case study or anything that stuck out to you through this language interpretation? And then I do see a question, should the interpreter not be looking at either the doctor or patient while interpreting? That's a good question. A lot of the research that I've done and a lot of the case studies that I've seen, it says that eye contact is very important, actually, especially with the patient, because again, that's building a stronger connection and it builds a stronger meaning for the patient. Thank you for that question. So I just wanted to share that with you all. But if again, if you have any comments or questions, just feel free to plug them in as we continue. So now that we kind of talked about, we saw a case study, we talked about the importance of language access in healthcare, and we talked about some of those benefits to having that implemented at your health center, as well as some language barriers. We're going to go into how to actually assess staff competency, right? And we're going to start off with the now. So the very first thing that you want to do is evaluate the process in place. So what do you currently have in place? I know that via the poll, some of you mentioned, you currently don't have anything in place or you're working on it or you're unsure. But for those of you maybe who do have something in place already, what kind of assessment is being used to assess competency? And how is it being used? And if you're currently trying to implement something or you don't have anything in place, what does that look like for you? How do you think that it should be used for your health center needs? Does it accurately assess the skill set of the staff members based on their role in providing language access services? So it's not just a matter of assessing all staff members, right? It's a matter of really thinking about and taking into consideration what is their role. Are they front desk? Are they a nurse? Are they a physician? Et cetera, et cetera, et cetera. Those go hand in hand. You have to really pay attention to what role they serve and what they're in order to assess their competency. Who are the staff currently involved in administering these assessments? And what needs to be revised to improve the process to fit its current needs? If you have something in place, when you go back to take a look at it of that assessment, what do you think needs to be revised? If you have nothing in place, what do you think will best fit the current needs of your patients and your health center? I do see something in the chat before I go on. Unfortunately, the interpreter is just there to interpret and can't advocate for the patients. Oh, this person saw a ton of errors in the video. I think it's important to consider how in-person interpretation is best. More than half of communication is nonverbal. I think interpreters often stand behind the patient so that the nonverbal communication can take place between the provider and the patient. That's good information to share. Thank you. Yeah, really good comments and really good feedback. And again, you all are at the forefront, right? Right there with the patients and helping with the providers or if you are a provider. So very good feedback, very good information to share. Thank you. So moving on and assessing competency. The next stage would be to assess the actual need, right? You identify proficiency levels that your health center staff needs in order to provide the best, in order to provide it based on the language needs of your patient population. So think of the needs of your patient population in order to identify what are the proficiency levels that you need your health center staff to have. So to do that, you assess patient language needs. You identify the languages spoken and the type of support needed through patient needs assessments or through like chart reviews, through staff interviews and surveys, or through screenings for different language barriers. And I know most, if not all of you, are already using multiple of a mix of these, or at least one of these. Um, you do so by tracking the number of patients that need language access support and at what points during the clinical visit. So do they need it at scheduling? Do they need it during the visit with a doctor? Do they need it afterwards when discussing medications or prescriptions, things like that? Um, you track the number of bilingual staff and their role in providing language access support. You define the levels of language proficiency to assign staff based on their skill set, right? So there's going to be different levels, and these are just some examples that you can use in your implementation, like the very basic level, which would be staff that can help with simple interpretation for maybe scheduling appointments, rescheduling appointments, or just talking on the phone after visits, just really simple, direct information. That's the very basic level, right? Then there's kind of like the mid-level, the independent level, where the staff can do a little bit more, like maybe explain more health information, explain different health programs that are being offered, or help patients understand just the overall healthcare system better. So that's a little bit more advanced than the basic level. And then you have like the more advanced level, which is the proficient level. And this is where staff can help interpret during clinical visits with providers and make sure that the patient really understands any important medical information or guidance being given. And next is the what. So now you establish the baseline criteria for each language proficiency level. And the main areas to be assessed in this proficiency are, of course, speaking skills, listening skills, writing skills, reading skills. And again, like we talked about in the previous slide, each of these are assessed on different levels, the basic, the independent, or the proficient, or however it is that you want to label them, but there must be different levels within those. And then there's medical terminology for independent to proficient user levels, and then medical interpretation for pharmacists or medical providers or certified medical interpreters specifically. And then you go into the who. So at this point, you identify current and potential bilingual staff at your health center or organization that can offer language access support and conduct assessment based on their different proficiency levels. Um, so you can do this by testing proficiency levels in different ways. Like you can use guided oral assessments, which examples of this can be maybe conducting role plays where the staff member leads like a mock patient scenario in the patient preferred language. You can conduct written assessments, and this can be done by using things like case studies, where the staff member must interpret the study and take notes of their interpretation in the written form. So maybe you can use the case study that we provided the link to at the beginning as an example, um, or you can use verbal assessments. And this is by actually having the staff member read aloud and interpret a specific document or maybe an educational material or pamphlet or resource that would typically be provided for a patient. And then lastly, you designate staff based on their role and proficiency levels to provide language access support. So here's where you really develop a plan to inform other staff members of their capacity and ways that they can be of support. You have to be sure to include the staff member's level of proficiency, how their support can be used, when they can help during the visit, and ways to document the language access support given to the patient. And then we jump into just a few extra tips and things to think about that we included. So, of course, along with language access comes cultural competency and awareness, right? Making sure that staff can communicate well by understanding and respecting the patient's culture and the patient's background. Um, we don't want to take away anything from the person's culture, right? We don't want to take away any foods, for example. We may just need to make some changes and modifications. It is important to give training on this for language access programs to really work well at the end. And then workforce development is also important. It's important to allow staff to get better at providing language support to patients. And that can include providing trainings, learning opportunities to improve their language skills, and keeping any language service certifications that they have up to date, because language certifications are very important. This is a little something that we just want to go over with you that we came across. So in this setting, you see on the screen, you see intoxicado, which to one it may mean food poisoning, but in the United States or in the English language, it translates to intoxicated, which we immediately think under the influence or under the influence of drugs or alcohol, right? So translating from one language to another, it's really tricky because when it comes to interpreting between a doctor and a patient, the stakes are even higher at that point, right? So this is a story of an 18-year-old baseball player. So in 1980, William Ramirez was taken to a South Florida hospital in a coma. His family apparently used the word intoxicado to talk about the person. Well, intoxicado in Spanish generally means that you ingested something or you have food poisoning, right? Um, so the family thought that something Ramirez had eaten might have caused his symptoms, but the interpreter translated their Spanish as intoxicated. So the doctor immediately made a diagnosis of drug overdose. A couple of days later, the health team figured out that Ramirez's problem was actually bleeding in his brain, but by then he'd suffered lasting damage. So he ended up quadriplegic. Um, so in medical situations, doctors and hospitals often turn to family members, like we were mentioning at the very beginning, right, for help with interpreting. But that can be dangerous and it can be problematic. So this is just another example of how when we translate words, what means something for someone can mean something completely else for someone else, or sometimes things always don't translate directly from Spanish to English, for example, or any other language aside from Spanish. So that's just an example that we wanted to share with you all. And then another example, I see something in the chat. Yes, Maria plugged into the chat to hear more about that specific case if you want to read more about it. So kind of picking up off from that, different words mean different things for different people. Like for example, as for a bus, in English it's a bus, right? But in Mexico they call it camión or micro or pecera. Whereas in the Dominican Republic or the Caribbean, they say guagua. If I pronounce that correctly. In South America or Argentina, you say colectivo or micro in Chile. So they're all different words, right? But they all, at the end of the day, mean bus, but not everybody knows that. So the importance of this is just to note how much language matters, because again, to one person, a word can mean one thing, but to another person, it can mean something completely different. And that could just be lost in translation whenever you're interpreting. So it's very important to consider the cultural component of words when translating as well. So we want to practice with you all a little bit. This is, if you want to plug into the chat a response to this question. So in this scenario, a physician stated, you will take lisinopril medication twice a day. That's what the physician told the patient. And then the interpreter interpreted what the physician said by saying, se tomará su medicamento 2 veces al día. So in this interpretation, what do you see, if anything, is wrong with the translation? And please feel free to plug in the chat. What do you think is wrong with this translation, if anything? Thank you, Raul. Glad you're making the distinctions. And then Estela, the name of the medication is missing. Anyone else? Well, Stella is correct. The name of the medication is missing. They omitted medication name. And that's so super important because, like in this case, lisinopril. Lisinopril is a high blood pressure, hypertension medication, or it's also used to treat congestive heart failure. Um, it's also used to improve survival after a heart attack, and it's available under different brand names, lots of different brand names. But it's so important to ensure that everything is being translated and nothing is lost in translation because this medication, for example, is very specific to heart-related problems. So, what if this person is taking multiple medications? What if they, well, like what medication, which one of my medications am I supposed to be taking twice a day? That can lead to dangers in taking the wrong dosages due to getting confused with the different medications that they have and things like that. Um, yes, and also somebody else said, make sure they understand what the need of the medication is for, not just the name. Yes, that's very important. Um, oh, that's interesting. Joshua shared uh, the word that I could not pronounce. Guagua is baby in Ecuador, and they say autobus for bus. That's very interesting fact. Do you see how different that is? Thank you. Thank you for sharing that. Um, would mentioning generic and brand names be necessary? I would think so, Maria. Um, so that individuals can know that if they offer them a generic name at the pharmacy, um, it would be the same as a brand name medication, unless they require the brand name medication. Some people may have a different reaction to the generic medication. I know that my mom, for example, can't take her generic high blood pressure medication. She has to take the brand name one for some reason. But that's a good question. If anybody else has anything that they'd like to share to that specific question posed, or anything else that they'd like to comment in the chat. Okay, we'll move on. Thank you so much. Oh, see. I feel like this touches on advocacy versus interpretation. As an advocate, I think your point is important, Maria. Thank you. So this is another video. I'm not going to show it to you all because it is 20 minutes. But Maria will be dropping the link in the chat. And this is, y'all will be getting, in the follow-up email, you'll be receiving this PowerPoint presentation. So you'll have access to all of this information. So we wanted to include this clip specifically in here for y'all to have access to. Again, it is a 20-minute video, but it does go through highlights of how to work with professional interpreters in a very limited English proficient patient encounter. So this is just an example, and as like some of you mentioned, it may have errors and it may have there may be room for improvement. But this is just again a sample video clip of just to give you a general idea of highlights of working with professional interpreters. So if you'd like to take a look at that, the link is in the chat. And this is another one that we wanted to share with you all because this is a medical interpreter practice video. And again, just for time purposes, Maria is going to be dropping this in the chat as well, if she hasn't already done so. This is a really cool little video because it's actually very interactive, and it's so that you can go back and maybe practice with your coworkers or with other health center staff, or practice on your own at home. It's really kind of like a mock medical scenario. And it's designed to really improve on or enhance your English, Spanish interpretation skills. So through this video, it'll kind of give you something that the provider says, and then it'll allow you time to interpret it. And that allows you to kind of dictate where you're at in your interpretation levels, right? It provides just invaluable opportunity to really refine your language proficiency, specifically within the medical context. So it's a very cute, very simple practice video that you can take back with you. So feel free to utilize that link as well. We're gonna jump into resources now. Currently, we do want to let you all know that we're working on finishing up a tool. It's a assessing bilingual staff competency tool. So this is a really great tool that you can download. It'll be available on our website, but we will also be sending you a follow-up email, another follow-up email as soon as it's finalized and designed and ready, and that'll be sometime in January, um, 2024. So keep an eye out on for those emails that you will be receiving with a link to this tool. And this tool is really just serves as it includes different tips. It includes steps in assessing your staff. It's really just kind of like a guidance tool that you can reference, that you can use in either to improve on whatever implementation process you have already in place for language access, or you can use it as kind of a starter to create your own assessments for language access at your healthcare. So we're super excited, and just keep an eye out for that. We'll be sharing that with you as soon as it's available in January, and it'll also be available on our website for anyone to download. And then just some additional competency assessment related resources included here. Maria will also be dropping each of these links. We found these very helpful and very useful. There's one that's a self-assessment tool for speaking, reading, and listening. There's another national standards for culturally and linguistically appropriate services or class in health and healthcare. And then a third one that we shared, which is a guide to providing effective communication and language assistance services. Um, so hopefully you will find these useful in addition to the tool, to the guide that we will be providing to you in January. And with that, this is my information. Feel free to get in touch with me at any time. This is my email. Maria will also be dropping this into the chat. If you need any technical assistance as you're working to make improvements on what you already have in place at your health center, or if you're working to create something at your health center for language access, please feel free to reach out with any questions. We can bounce ideas off each other. I can connect you with different resources that we have available, and just really help you get a jump start on that or make improvements on what it is that you already have. Um, but I would like to thank those of you who are joining us from the recording. Thank you for joining us today. And those of you who are currently here present with us, please stay on because we are going to be completing evaluations. We have a few minutes for questions and answers and additional comments. I do see we have comments in the chat, so we'll go over those and additional resources that we'll be sharing. Thank you so much.